So Janet presents to the office with headaches and low back pain. She's been coming into the office her entire pregnancy. She's 8 months pregnant now, and she gets adjusted every 2 weeks at this point. She presented initially to the office with sciatica and a lot of low back discomfort, which is a very common thing with pregnancy. There's a lot of stretching of ligaments and tendons in the pelvis with pregnancy. So we want to make sure that everything stays nice and loose and that the spinal segments are in alignment. So she comes on more of a maintenance at this point in time, and her sciatica has resolved. So what we do is we just check her. We want to make sure that the pelvis is aligned properly, because at any point in time she can also go into labor. So one of our specialties in the office here is pregnancy and sciatica along with that. So we have a lot of experience with that. So the adjustment is very simple. We're going to have you lay on your side facing me. Okay. Good. All right, let's have you lay on the other side. So it's a very small force that needs to be applied to the pelvis in order for us to realign it and get it back moving like it needs to. But again, it's extremely important for the birth, lay on your back for me, for the pelvis to be aligned, because you want to keep as much room for that baby to come out as we can. So extremely important. Every pregnant woman should be under chiropractic care, more on a maintenance. So we do a lot of stretching on the low back as well to make sure that, again, all those pelvic muscles are nice and loose, and that, again, it just keeps everything really healthy for the birthing process. We have a lot of women in the office that are referred to us from their OB or their midwives for breech babies. And that's when the baby turns and is not in the position that it needs to be in order to give a normal birth. So we have a lot of experience with the Webster technique in order to get that baby back into normal positioning. So we're also treating Janet for her headaches here in the office. She's done very well. Studies show that 80% of headaches come from your cervical spine. So we notice that with headaches, we get a lot of muscle tightness in the upper cervical spine that stops that first vertebrae or the second vertebrae from moving properly. So we always want to make sure that that vertebrae is moving like it needs to. And the success rate in the office here is tremendous for headaches that come in. We do very well. Incorporating the muscle work and massage with the treatment, as well as the stretching, our patients progress very quickly and do very well with care when they're presenting with headaches. We also want to make sure that there's nothing else complicating the headaches, that something else that could be going on with our patient. But again, studies are showing that 80% of headaches are coming from the upper cervical spine. But again, if our patients are not getting better with care, we make sure to refer them out to the proper physician for their issue. Very good. Excellent.